Hi guys, welcome back to another video. In this video, I actually have OBGYN Dr. Marta Perez with me, and we are going to be talking about pregnancy and the COVID vaccine. You guys have a ton of questions, and so all the questions that ended up in my DMs that are not for me, I am going to pass on with for Dr. Marta. So, Dr. Marta, before we kind of dive too far in, what do we know about the COVID vaccine and pregnancy, but also COVID and pregnancy?
Great. Exactly. That is the exact dynamic that people should be using to make this decision. So, what we know about COVID and pregnancy is that pregnant people are more likely to experience a severe form of disease and may even be more likely to experience mortality or death as a result of the disease. Now, the absolute number of that happening is very rare. It's much less than 1%, but it's higher than if you take the same person, same gender, health status, et cetera, and put them not pregnant and the same pregnant person next to each other, the pregnant person is at higher risk. So there's a lot of other things that go into risk for COVID, your own situation, your exposures, your community, et cetera, et cetera. And then when we turn over to the vaccine side, what do we know about the COVID vaccines and pregnancy? So there's two available vaccines right now, the Pfizer and the Moderna vaccine. They're both a type of vaccine called an mRNA vaccine, which is new to market, but has been studied for decades with different viruses, but it's newly being rolled out in the setting of COVID, which is great. They're very effective with a very low side effect profile, but when they were doing the trials, which together with both types of vaccines included 70,000 people, they didn't include pregnant people in the trials. So we actually don't have data on pregnant people or breastfeeding people. We do have data on other, young women of reproductive age, which were included in the trials. So if you're not currently pregnant or breastfeeding, you would have been included and can expect that high efficacy. So what we don't know is how effective or if there's additional side effects that pregnant people could expect. And so in the absence of data, it leaves a lot of people wondering, well, what do I do then? And so I have what most organizations and OBGYNs and doctors have advised patients is that you get to make the decision about receiving the vaccine based on what's important to you, based on protecting yourself from COVID and how important that is, based on your tolerance of some risk with maybe not knowing about the vaccine. But I always touch on this saying, we don't theoretically know of any risks. So the type of vaccine mRNA is a very safe type of vaccine. It's going to be more similar to the vaccines that we know are safe in pregnancy than it is similar to vaccines we don't recommend in pregnancy. And we wouldn't expect there to be risks, but of course we don't have data, so we don't know. What we could find out after trials are done, which could be years and years in the future, is that perhaps pregnant women benefit even more from the vaccine. So there's a potential to find that there was a downside to getting a vaccine while pregnant, but most organizations for the OBGYN think that actually what we'll probably find out is that there's a huge benefit to getting the vaccine, but we just don't have the data.
That's fascinating. And there were people who got pregnant during the trials. So in these
Yes.
upcoming months, we will have not large amounts of data, but we will at least have individual cases that we can look at to see how that turned out.
Sure. Yeah, those number of people, they were very small. I mean, certainly it's reassuring that like nothing out of the ordinary happened, but they were very small and they'll probably give birth later on. What we are seeing though is that tons of pregnant healthcare providers who have been eligible for vaccination over the last month have chosen to get vaccinated in all different trimesters. My DMs are full of them. So studies are ongoing trying to survey these women about what, if they experience side effects, what happened, et cetera, et cetera. Looking backwards at data, like what happened after you got the vaccine is not as great as looking forwards in a trial in terms of research, but it's definitely better than nothing. So I would expect us to have some information about that around maybe the fall or winter time of 2021. Summer would be really soon for that data to come out, but probably more fall or winter.
And we're able to track this through the VSafe program that
Yes.
once you get the injection, the vaccine, you then go and fill out your information. Is that correct?
Yeah. VSafe is collecting information on pregnant people. Of course, VSafe, if you filled it out, I have, because I've been getting it as a breastfeeding mama. It doesn't ask that many questions. Like it asks about your side effects, it doesn't ask that much, but it doesn't collect that much data. So there's also ongoing research studies. I actually have a highlight for them in my Instagram if you're interested in joining one of the ones I hear of that will ask more in-depth questions about pregnancy specific outcomes, et cetera, and maybe probably compare to pregnant people who weren't vaccinated and look at outcomes. So that data will probably be available in a few months.
Sure. Okay. And what do we know about immunity being passed for people who got sick, who either contracted
Yep.
COVID during pregnancy or got the vaccine during pregnancy, or do those differ because they're a little bit different?
Yeah. So we don't have the data on the vaccine and passing immunity yet. So we'll go theoretically off of other vaccines in pregnancy. I'll get to that in a second. What's really exciting is we're just starting to see all of the data from this past summer and spring, summer, and fall of COVID, and the studies that were ongoing then on passing immunity. And at that time, there wasn't a vaccine available. So that was with actual COVID. And we did see that pregnant people who experienced COVID did pass antibodies on to the fetus.
Wow.
And they were more likely to pass antibodies the more severe their symptoms were, or the higher their antibodies got in their body. The other thing is, we know that the vaccine is better at producing an immune response than getting COVID is. Okay, a lot of people don't think that. They think, oh, your body having COVID is going to be better than the vaccine. It's not. The vaccine is better at producing immunity. So, and we avoid all those negative problematic side effects. So this is why we give other vaccines during pregnancy too, is that so the mother can transmit the antibodies to the fetus and protect them, because those maternal antibodies stick around for a few weeks to months. So hopefully we'll see, and I'm sure that we will, we just don't have the data yet, that getting the vaccine during pregnancy also passes on those antibodies. But I think the take-home message is there is immune benefit when mothers pass antibodies to babies. We do see that with the COVID infection. It would be better with a vaccine than with an infection, but we just don't have the data on how great it is yet. But with a vaccine, we get to avoid being really sick and some of the complications with COVID.
Sure, with a very high efficacy rate, right? This is a vaccine that has an incredible efficacy rate, which can't
Yeah.
be said for all of our vaccines, right? Okay,
Yeah.
so my next question is, when we're talking about the vaccine, do we see any sort of heightened risk with miscarriage or complication with placenta? Both of those things kind of were floating around the internet. What does an OBGYN say?
Yeah, we have not seen any complications. Again, we don't have data quite yet, but all of the big professional organizations, which are made up by more than just me, people who are experts in the placenta, experts at immunity, experts in fertility, experts in pregnancy and infections in pregnancy, are all saying there's no theoretical risk with the vaccine. They can't think of a reason why, in everything they know about science and the placenta and the vaccine and COVID, they can't think of any reason why the vaccine could affect fertility at all. So there's no theoretical way that anyone can come up with why that could happen, or pregnancy complications at all as well. It's important to remember that when we're talking about a vaccine versus the illness, everyone wants to say, oh, is there a risk to the baby of the vaccine? Can anyone think of one? And our answer is we don't have data, but nobody can really think of much of a theoretical risk. But maternal well-being is directly linked to fetal well-being. So if mothers are protected from COVID and severe illness, they're protecting their baby from severe illness, which is bad for a fetus's life too. There was a quote that says, the fetus tolerates maternal death poorly, and maternal death crosses the placenta. Like, it's important to always keep in mind that what's good for the mom is good for the baby in almost every single situation that we encounter in medicine.
Absolutely. Okay. And my final question is, if you were pregnant and you contracted COVID and now you're eligible for the vaccine, what are the recommendations about getting the vaccine, or do we assume that you have the immunity from your natural contraction of it?
Yeah, again, the natural immunity is not going to be as robust as vaccine immunity. So certainly a pregnant person in that situation may have a more complicated decision of no immunity versus immunity from the vaccine. They may have does my somewhat immune response from having COVID, is that maybe enough versus getting the vaccine for better immunity? And that would be a discussion they can talk about with their healthcare provider, but they absolutely can get the vaccine if they've had COVID before. There's only really a waiting period for if you've received antibodies as a treatment, which is just starting to happen for pregnancy. That was studied and is just starting to. So people who had COVID before probably weren't getting it. But again, talk with your doctor about the risks and benefits. But I think a lot of people who are not in the science realm or don't understand vaccines may erroneously think that having an infection would confer better immunity than a vaccination. And that's not right. The vaccine is seeing better immunity than the infection.
Sure. Absolutely. Dr. Marta, thank you so much for sharing your wisdom. I know we all appreciate you. Thank you so much for being here, and I'll see you guys in the next video.